I was diagnosed with bipolar disorder about a year ago exactly in March. Um, I joined the Youth Advisory Council just a few weeks ago because I wanted to share the message about bipolar disorder and that recovery is possible. And I also like connecting with other people who have similar experiences as me. I was diagnosed with bipolar disorder about a year ago exactly. I had been going through a manic episode. I didn't recognize it for quite some time. Um, but the symptoms got pretty severe and it was interfering with my social life and my academic life. So, and a therapist kind of recognized that I might have bipolar disorder. So she referred me to a psychiatrist. I was diagnosed in March of last year and I started taking medications to help with the manic symptoms. I did have one experience of a visual hallucination during that time. It took a really long time to find medicine that worked for me, so the mania kind of persisted for quite a few months. And then once the mania ended, I went into a depressive episode where I started having a lot more visual and auditory hallucinations and illusions. I've been working with a psychiatrist, a therapist, and a social worker, and I'm in a place where my mood is stable and I'm not having hallucinations, and I'm able to perform my day-to-day tasks and go to work. I was actually in my psych class and we learned about bipolar disorder, and that's when I recognized that I started having a lot of the symptoms of mania that I was learning about in my class. And I started talking to some of my peers about it, and they agreed with me that that was a possible diagnosis, and so I decided to seek out a psychiatrist. I really rely on my care team. I've kind of struggled. I didn't have health insurance when I was first diagnosed, so I was then seeing a doctor out in California over the internet, and that was not very helpful. And then I briefly had a psychiatrist through Medicare who was not very attentive. And so now I have just a private psychiatrist that I pay out of pocket for, and he has his own private practice, and he's been fantastic, and I really credit him with my recovery. I was definitely nervous about telling my school and my work about my bipolar disorder because I do think there's a lot of stigma against that, and when people think of people experiencing psychosis, they kind of picture the people on the street talking to themselves loudly, and that's not at all what my experience has been like. So I have been very selective in who I share my diagnosis with. At work, I haven't told anybody. I do have an accommodation at work to do day shift instead of night shift, but even the HR department doesn't know my exact diagnosis. And I would be hesitant to share that just because of the stigma around bipolar disorder. I would say the most important thing is being compliant with your medications. There's really no other treatment besides medications, or at least including medications, that works for psychosis, at least in my experience. I would say finding a psychiatrist that you really trust is very important, as well as kind of a larger support team like a therapist or a social worker. I only took about a week off of nursing school, but I would definitely say that it's okay if you have to take a break from your school or work to get your mental health in order. I kind of wish I had taken more of a break and jumped into treatment a little bit more thoroughly, because I think it would have made the symptoms go away faster than trying to deal with it along with school and work. My mom is extremely supportive. I also started going to AA following my manic episode, and so I have a whole bunch of friends in AA, and then I also have a sponsor who herself is a psychiatrist and in recovery. So I lean heavily on the support of AA. I go to meetings at least once or twice a week, because as a nurse, I've treated a lot of bipolar patients, and a lot of my patients haven't had very much support. A lot of the nurses and doctors I work with aren't very familiar with bipolar disorder. And I just see patients with the same diagnosis as me who are really struggling and don't have the support that I have. So I think I joined the advisory council in order to hopefully reach out to people like that and to give them more support and show them that it is possible to have a successful career and a successful life living with bipolar and psychosis. I think with the psychosis, for me at least, it was challenging because sometimes it can be difficult to recognize if something's real or a hallucination or illusion. So the first time I experienced psychosis, I was in my kitchen and I thought there were like some like flies or bugs flying around the ceiling, but there was just something about them that didn't look quite right, kind of the way they were moving and the shape of them. So I remember I took off my glasses and they were still there, but they weren't any more blurry. And so that was kind of a signal to me that they weren't real. And after maybe 30 seconds or so, they went away. And then I had a similar experience like that at work where I saw this black floating object that kind of looked like maybe it could just be like dust or something. Um, so I stared at it for quite some time before I realized that it wasn't actually there. So I think that's something that's really difficult about psychosis and hallucinations. And I definitely felt like I was crazy or there was something wrong with me. Like, why was this happening? Why didn't I recognize it right away? Um, but I think the more it's happened, the more I've been able to quickly realize what is and is not real. And the more I'm able to just ignore the hallucinations. It's helped a lot with the hallucinations. I still occasionally have what are called illusions. And so for me, what that looks like is like a very textured or patterned surface, or like a rug will sometimes look like it's moving. It has like a wave pattern to it. So I've experienced a lot of illusions. And for me, that happens with like textured or patterned objects like a rug or a carpet. And it looks like they're kind of moving, almost like there's like waves, or sometimes it looks like they're zooming in and out. But it's important to note I never actually thought the objects were moving. It looked like they were moving. But during my depressive episode, when I was really kind of down and not thinking clearly, I started thinking that maybe the rugs had always looked like they were moving and I just hadn't noticed it before. Or maybe other people also saw their rugs as moving objects and just didn't talk about it. So one thing I did is I would ask my close friends to come over and look at the rug and see if they thought it was moving. And none of them did. So that kind of showed me that this was just something that was happening in my head. And I just tried to ignore it. And it has gotten a lot better. I'm on Zyprexa now. And it's much, much better. It's only occasionally happening. I've had a really difficult journey with medication. I've been on Lamictal, lithium, Latuda, Abilify, Zyprexa, Buspar, Lexapro, Ativan, hydroxyzine. So tons of different meds, and I've experienced many, many side effects from them and lots of drugs that didn't work for me. And it really did take just about a full year to find a set of medication that works for me. So I would definitely say to people not to be discouraged if the first or second medicine they try doesn't work. And also that you don't have to live with unbearable side effects. If a medicine really isn't working for you, you can talk to your psychiatrist and get switched to a different medication. I think for a while it was hard for me to accept that I had bipolar disorder because during the manic episode, I was really enjoying it and I was really happy and I felt like I was living my best life, and so it was difficult to see it as an illness. And then during periods of stability, I thought that maybe the bipolar had gone away and I was better. I've always been compliant with my medication. There's only been a couple times I didn't take it, and that was because I was having a lot of nausea and vomiting, and so I just felt like taking it wasn't worth it because I was just going to throw it back up. But there's definitely been times like during the depressive episode where I felt like the medicine was making it worse and I didn't know what to do. I've been to the emergency room five or six different times for bipolar disorder. I experienced akathisia from one of the medications, and then I went to the ER a couple times during my manic episode, and then once for nausea and vomiting from the lithium, and then another time during the depressive episode. So anytime I kind of felt like it was hopeless and I couldn't take my medication, I would either seek out my psychiatrist or go to the emergency room rather than just stop taking my medication. And they were always really helpful in the emergency room to kind of figure out what the issue was and get me on a new medication right away when I felt like I couldn't wait any longer. Now I kind of view bipolar as just another part of my life and something that I think makes me who I am. And so I definitely like to kind of embrace it as much as possible and see the good parts of it. I think joining the Youth Advisory Council kind of helps me to relate to other bipolar people and also to share the message that there is hope with this illness, there is hope with psychosis, and it does get better, especially if you're able to talk to other people about it and feel less alone.